Dr. Gary Sykes, obstetrician, Sydney Adventist Hospital. Technology's had a huge impact on obstetric care, very big. And one significant area is in ultrasound scans. The equipment these days that we use, indeed I have in my own office, is amazing and certainly wasn't around that long ago. And patients will bring their mothers with them and say, "This is incredible, we never had this in my time." You can do incredibly good imaging. They can see the baby on the screen, 3D, and they can see it moving. We call that 4D. And this is there for the patients. And I do this every antenatal visit and give them a USB, free USB, so store the baby photos, the baby videos on it. So this is something that wasn't around when I started as an obstetrician by any means. But it also means you have much greater accuracy in assessing the baby's growth. Much better than the old methods of assessing how the pregnancy is going, how the baby's growing. Now, I don't pretend to be a specialist in this area, and there are doctors here at the SAN. There's the SAN Ultrasound for Women. We see excellent doctors who are specially trained in this area. Specially trained means greater accuracy, and so I and my colleagues rely on their services to give that greater accuracy. A woman may have an ultrasound scan at 12 weeks to check the baby's anatomy, early signs of there being a problem with the baby's development. Also, she is encouraged to have a morphology scan at about 19 weeks. Morphology scan basically means we're looking again at the baby's anatomy, looking for developmental changes. And I've certainly had quite a number of times, so I'm very relieved the scan has been done. Everything from cardiac problems. I've got a patient currently where there's an abnormality of the baby's spine. Now we're able to plan, she's seen a pediatric orthopedic surgeon already, and we're able to start planning for what's going to happen after the baby's delivered. So this is where the morphology scan, done by excellent people with special training, such as the SAN Ultrasound for Women, comes into its own. Subsequent scans may also be needed by these specialist people if you worry about the baby's growth and well-being. So certainly we can rely on for that reason. Another indication I'm thinking is placenta praevia. If the placenta is unusually low, covering the cervix. So you do need to call on these other people to support you in pregnancy care of the patient as the situation dictates. Fetal monitoring is done in labour. With fetal monitoring, we are checking two parameters. We're looking at the baby's heart rate pattern and also uterine contractions. And we look for a reassuring, what we call trace or fetal heart rate pattern, consistent with the baby being well oxygenated. If we see an abnormal pattern consistent with the baby not being well oxygenated, we call that fetal asphyxia or fetal distress, then that's a concerning indication that may warrant an operative vaginal delivery if she's in second stage, or if it's in first stage, a caesarean section delivery. Sometimes there are measures that we can take during the labour to improve the situation, and so these interventions are sometimes it's possible to avoid them. But certainly fetal monitoring is important. Now, it's more important when the woman is known to be at high risk of the baby getting distressed in labour. So you've got low risk and high risk. If it's what we call a low risk patient, then it's done intermittently, and certainly she can have periods when there's no monitors attached at all to her. But if there's high risk, then certainly should be continuous monitoring. Also, if she has, for instance, an epidural block, then it's considered that she should have a continuous monitoring throughout the whole labour. And fetal monitors has come a long way. Today we've got amazing machines, such as this machine here, where we can get accurate tracing with the woman not actually being wired to the machine, so to speak. So she can be ambulatory, walking around with a device on her tummy, picking up the baby's heart rate, and that is remotely being recorded to here and also to the nurse's station outside. And indeed, I can dial in and I can see it in my office. So I can be in my office or at home and I can see how the baby's heart rate pattern is going. I can see her progress in labour. I can see the baby's well-being, and I'm not even on site. That is incredible. That's absolutely amazing that you have that ability to be able to safely manage your patients, even though you're physically not in the building. Technology in the form of ultrasound scans and fetal monitors in labour, and also fetal monitors used antenatally, have dramatically improved our ability to monitor the baby during the course of the pregnancy and optimise the care of the baby. That means there's certainly much safer for the baby than it was before. We're able to see and decide on how things are going and take appropriate steps that are necessary, and certainly optimise the chances of a good outcome.